afternoon. My name is Rosemary Gadalgo. I'm an MSN student at the University of Texas, El Paso. I'll be performing a head-to-toe assessment on our volunteer. Our volunteer today is Mercy. Our volunteer today is Mercy. Hi, Mercy.
Hi.
So the vitals were taken. Her blood pressure was 121/64. Her temperature was 98. Her respirations were 18, and her weight was 234 pounds. I also did ask the patient to empty her bowel, so we'll start. So to start with, Mercy, I'll start with your head and I'll proceed all the way to your feet. So I'm checking her scalp to make sure there are no noodles. Her hair distribution is okay and there are no masses. Does that hurt?
No.
Okay. Next, I'll be checking her facial. Do you mind taking off your glasses? I'll be checking her facial bones. Let me know if any of that hurt.
No.
Okay. Her hair distribution is okay. I'll also check her eyes. I did check the eye vision acuity via the Snellen chart. So I'll be checking her eyes for accommodation. Okay. I'll also be checking her eyes. I'll be checking her eyes. I have to get to this side to check the other eye. Checking the veins and to make sure everything is okay over there. Next, I'll ask you to follow my finger with just your eyes. Do not move your face. Okay, good. Next, I'll be checking some of the cranial nerves at this point. Would you please shut your eyes all the way down? Let me open them. Okay. Would you please also puff up your cheeks? Okay. Bring your tongue to this side against my finger and this other side. Next, please open your mouth. Say ah. Okay. And at this point, I'll also check your mouth just to see how everything is. Okay, everything is okay. I'll also check your peripheral vision. So tell me when you see a wiggly finger coming your way.
There.
Okay. Tell me when you see a wiggly finger coming your way.
There.
Okay. And how about this way?
There.
Okay. From the bottom.
There.
Okay, good. Okay. Next, I'll be checking your nose. So to do that, I will use this. Okay, I see your tympanic your septum. There is no visible septal deviation, and it's pink and nice. And I'll also check for your sense of smell. And to do that, I'll have you close your eyes. Close your eyes and tell me what you smell.
Alcohol.
Alcohol, okay, good. Okay, close your eyes again. Tell me what you smell.
Coffee.
Good. Okay. The next, I'll also be checking your ears. And to do that, I'll use the ringing fork. Let me know if you hear it equally on both sides, both ears.
Yes.
You do? Okay. And then for the next step, I'll check each ear separately. First, I'll put it against the bone to check bone conduction and against the ear. So you'll tell me when you stop hearing the sound.
There.
There. Tell me when you stop hearing the sound again. Good. Check this other ear.
area.
Okay, good. Okay. Next, I'll perform a whisper test. So I'll stand behind you and you'll tell me what word I say. Close your left ear. Hungry. Okay. Then I'll come to this other side.
Right.
Good. Okay. Thank you so much. You can put back your glasses. I'll next be assessing you. I'll come to your neck and I'll start by palpating your, no, I'll palpate your ears first just to make sure things are okay there. Okay. And then I'll also check inside your ears. Okay. Okay, I see the thymatic membrane. It's gray, and there's a little selenium in there. It's also gray on this other side with this some selenium. That's good. Next, I'll go down to your neck. I'll be checking for the lymph nodes, making sure that the trachea is midline, and also later on I'll also assess your thyroid. So I'll palpate the lymph nodes. And then I'll come to the back to assess your thyroid. Palpate your thyroid. It's there, and there are no noodles or anything like that. Come to this other side and assess your thyroid again. No noodles on that side as well. I'll assess your cranial nerves by asking you to shrug your shoulders, and then do not let me push your shoulders down. Good. Next, I'll listen to your lungs, but first I'll listen to the front and then I'll listen at the back. Do you have any problems with your lungs? Any problems breathing? Any asthma? Anything like that? No? Okay, good. Okay. Okay, so take a deep breath. Deep breath. Deep breath again. Deep breath. I'll also listen to your lungs at the back. Take a deep breath. So the next one is I'll percuss your lung fields at the back, and I'll do so on side to side, systematically from one side to the rest, to the next. I'll also check your diaphragmic, your thoracic expansion. So I'll ask you to take a deep breath and hold. Take a deep breath. Okay, release. Thank you. So when she did that, my hands did move equally. That shows that both lungs, are filling up with air as she breathes. The next, I'll check your tactile parameters, and as I touch each field, I'll ask you to say 99. So whenever I touch each field, you say 99.
99, 99, 99, 99.
Okay, good. Next, for the purpose of this assessment, the breast and the genitalia will not be conducted today, but on a normal, head to toe assessment, those are usually included. Next is your abdomen. I'll be checking your abdomen. Any problems with breathing? With your stomach, any issues?
No.
Okay. So for the purpose of this exam, I'll ask you to lay down, and I'll pull over your shirt and cover you up. Open up your shirt first, just a little bit. So first I'll start by listening to your bowel sounds, and for the auscultating the bowel sounds, you do so for up to 2 minutes until you hear bowel sounds in each of the 4 quadrants. Next, I'll do the percussion, and I'll start by percussing each of the 4 quadrants, and then I'll percuss on the right border, the upper margin for your liver, so and the lower margin, and then I'll percuss this side for the spring, and then I'll palpate. Let me know if you feel any discomfort or any pain. So initially I'll do a light palpation, and then a deep palpation, no masses or anything like that, or any hernias observed. She didn't have any scars, so that means she probably has never had any surgery on her abdomen, and there are no lesions observed. Next, I'll listen to your abdominal vessels. I'll start with the aorta, and for that we'll use the bell of the stethoscope. Lower that. So the aortic. And what I'm looking for here is to hear, just the breaths, and the thrills, or if there are any breaths. Aortic. The iliac. The renal. And then down here we'll be listening to the femoral. Sit down. Thank you so much. I'm also going to go back to the back and assess her spine, just to make sure that it's midline. So her spine is bent over a little bit more. It's midline, so that's good. Next, I'll assess her hands. I'm palpating and checking this, assessing the skin to make sure there are no masses